Doherty, you have the floor for 5 minutes.
Dr. Sarita, I don't believe you answered the question from my colleague earlier. Are you aware that there is safe supply being diverted at Chapman's Pharmacy across the way from your office? Yes or no?
It's not a yes and no answer.
It is a yes or no. Are you aware or no?
I'm going to decline to answer a complicated question.
Okay, that's fine.
Without being given a chance for a complicated answer.
Okay. That's fine. So you deny that it's happening across the way?
No, that's not what I said, sir. I said I needed time to explain.
Okay. Do you agree that it's possible that diverted opioids are ending up in the hands of people that they aren't prescribed to, or even children? Yes or no?
We have no evidence that they are ending up in the hands of children. We have no scientific data that supports those assertions.
What's the leading cause of death in the province of British Columbia for youth?
It is overdose from fentanyl.
Thank you.
From fentanyl.
Okay, thank you. What is your relationship between the clinic and Chapman's Pharmacy? Is there one? Do you meet with them regularly?
We have a professional relationship because due to their proximity to our clinic, a majority of our patients choose to use that pharmacy. And so we are in nearly constant communication about how to better serve our patients and improve health outcomes.
Do you believe that physicians that prescribe safe supply are morally or legally responsible for diverted safe supply prescription that bear their name?
I believe that every medication that has any kind of value can be diverted, and of course
Are you morally or legally responsible as a physician for that medication if it is then taken as you prescribe it and then sold on the street?
I am morally responsible for my patients to stay alive. I am morally responsible to care for my community.
All right.
And the suggestion that safe supply clinicians don't care about the larger community is quite frankly extremely
I didn't say
offensive.
that, actually. I just asked you if you felt that morally or legally that physicians that prescribe safe supply, are they morally or legally?
Responsibility to our clinic.
Thank you.
The legal responsibility,
I appreciate that.
you'll have to ask the lawyers.
A healthcare worker purchased thousands of hydromorphone pills prescribed through your clinic, which led him to escalate his addiction and cause serious harm to himself and his family. What would you say to him, his wife, and his children?
I'd like to know where this anecdote is coming from first.
Well, I never asked you where your anecdotes came from, so I think it's me, again, asking questions. That's my time. Dr. Sarita, how often have community members, including family members of your patients, tried to contact you to express concerns about safe supply diversion originating from your clinic?
Community and family members? Never. We encourage family members to come into our clinic with
their family. So at no time
family.
has a patient's family member come to you? Okay.
No.
Okay. Do you support the improved traceability measures of so-called safe supply?
I don't. I think that's a slippery slope around marginalized
Why would that be a
communities.
slippery slope?
We don't put tracers in any other kind of medication.
So can diversion...
Why would we stigmatize people who use drugs? Why would we assume that people who use drugs have nefarious intention with their medications?
Wouldn't you want to make sure...
We know that over 90%...
Don't you think, can you and I agree that there are many different tools around this table, and there's many different views, but do you not think that we should be doing everything in our power to make sure that we're keeping people safe?
Yes, I do, by investing in evidence-based programs.
Do you believe that traceability would then cause diversion to maybe come down?
No, I don't. I think it would cause people not to use harm reduction programming because this is a group of people who have been criminalized for decades, actually 100 years. These are people who, you know, on our program we have 30% Indigenous folks, and we know that is true of most safe supply programs. I don't think anybody who has had a violent relationship with the structures of medicine and government is going to be wanted to be tracked in any way, so it will lead to death because people will not seek
illegal?
Treatment. Is diversion illegal?
Yeah. Yes
for
or no?
people to sell their medications, yes, that's illegal, just like they sell methadone.
Okay. Did you receive $1.5 million from the National Safe Supply Community Practice that deems what's their words? They deem diversion as compassionate health care?
So I did not receive that money. Certainly the Safer
clinic?
Supply Community of Practice received that money. I'm aware of the diversion document that you're referring to, and it was written by expert clinicians as well as evidence and advice.
How can you justify that funding, though, if it's an illegal practice?
So I think you're referring to the funding for the community of practice, the National Safer Supply Community of Practice. It's not funded to defend diversion. It's funded to support people nationally in learning about safe supply,
Thank you, Dr.
helping them in
Sarita. I'm going to have to
practice,
stop you
and
there as well.
disseminating
Thank you very
information.
much.